I'm Dr. Richard Brownlee. I'm a neurosurgeon and I work at the Welcome Back MRI and Pain Management Center in Kamloops. And today I'm going to talk about lumbar spinal stenosis. So what's lumbar spinal stenosis? So have you ever been to the mall and you've seen these elderly people walking all bent forward, leaning on their shopping carts? Or if you see people walking down the street and they're all bent forward, leaning on a walker because they can't stand up straight, it's usually because they have spinal stenosis. And what that means is that they get pinching of the nerves in their back that results in symptoms in their legs with activity. That's called claudication. And there's two things that cause claudication, which is pain or aching in the legs with activity. One can be due to poor circulation in your legs, but the other one is due to pinching of the nerves in the lower back, and that's called spinal stenosis. So people often don't have pain when they're at rest. Sometimes they'll get pain at night when they're lying down, but most people get symptoms when they're active. They find that they progressively can walk shorter and shorter distances before they have to stop and either sit down or bend down to relieve their symptoms. Most people find that bending forward makes their symptoms better, so that discomfort in your legs will get better if you're leaning forward, and that's why people walk and look like an old person with their being all bent forward when they're walking. So I'll explain exactly what that is. This picture here shows what spinal stenosis is. This little model shows what the normal anatomy is. So in the lower back, all the nerves are contained within this tube. So the front of the spine has the vertebrae and the discs, the back of the spine has this arch of bone, these little joints called facet joints, and then ligaments in between the spine. So as you get older, people develop osteoarthritis in these little joints, and the joints become enlarged. Also, as you get older, the discs become weakened and they bulge backward, so that encroaches on the spinal canal from the front. The facet joints encroach on the spinal canal from the side, and then the ligaments in between the spines also become thickened. So you have basically three different components that result in narrowing of this spinal canal, which contains all the nerves, and that's called lumbar spinal stenosis. And they grade stenosis as mild, moderate, and severe depending on how severely narrow this is. Most people don't get symptoms until the stenosis becomes moderate or even severe, and then again the most common symptoms they get are aching in their legs. Some people will get some numbness, but it's mostly restriction of their activity. And the treatment for spinal stenosis is basically surgical because it's a structural problem, and the surgery we do are called laminectomies, and that involves removing the arches of bone at the back of the spine and the ligaments to open this space around the nerves. So the symptoms improve after surgery. When people come back, the two things they say is they can stand up straighter because they don't have to bend forward to relieve their symptoms, so they feel taller, and they can walk again. People can walk more than a block without having to stop and sit down or rest to relieve their leg symptoms. So spinal stenosis causes mostly symptoms in the legs. Some people do get back pain as well, and they find that their back pain occurs when they're standing. So if they go shopping, they have trouble standing in the checkout line because their back starts hurting and they have to go and sit down. So lumbar spinal stenosis usually affects people over the age of 60. So as you get older, you're more likely to get spinal stenosis, and it's more likely to restrict your activity to the point that people become housebound and they can't even get out and go shopping anymore. So if you have those symptoms, the best test for that is either a CAT scan or an MRI scan to show the structure of your spine and whether the nerves are being pinched. And if you do have those symptoms, you need to get your family doctor to refer you to one of the neurosurgeons or spine surgeons so that they can determine whether you're a surgical candidate and whether it can help relieve your symptoms and get you back to a more normal life again. So hope you learned something today about spinal stenosis.